friends and welcome to your channel Nursing Informatics. This is your friend Sudip Das, and today our topic is antibiotics related to pharmacology. Okay, so let's start the antibiotics. So before starting, I would like to say, if you are new in my channel, please do subscribe in my channel and click the bell icon for new updates. So what is antibiotic? The antibiotics are the drug or substance that will help to kill or inhibit the bacterial growth or fungal growth or viral growth. Okay, so and what is antibiotic? It is a substance or component that will inhibit or kill the bacteria, then virus, fungus, means microbes. Okay, so next is classification. There is major 6 classification in the antibiotics. First one is inhibit cell wall synthesis. It will inhibit the cell wall of the bacteria when it got synthesized. Okay. Number 2 is inhibit protein synthesis. The inhibit protein synthesis indicate the protein like mucopeptide and peptidoglycan, which is helpful for formation of the cell wall in the bacteria. It will inhibit that protein. Okay. Third one is inhibit DNA guidase. Inhibit DNA guidase means it is an enzyme which helps to formation of the DNA. So this drug inhibit that enzyme. Fourth one is interfere with DNA function. It will mainly inhibit the DNA function. Number 5th is interfere with DNA synthesis. It will inhibit the DNA synthesis, means it will inhibit the replication of the DNA from one DNA to another DNA. And last one is metabolism, means it interfere with metabolism. So in the cell it will inhibit the metabolism process. So this is the main 6 classification of the antibiotic. If you say the examples, the inhibit in the number 1 is you can say the penicillin. Number 2 is azithromycin. Number 3 is ofloxacin, ciprofloxacin. Number 4 is metronidazole. Number 5 is acyclovir, and number 6 you can say sulfonamides. Okay. Next we come to the drug doses and frequency. But dear friends, the drug doses and frequency only depends on the intensity and severity of the disease or bacterial or viral infection. Okay. So there is no certain rules for drug dose and frequency. It depends or it fluctuates on the severity or the infectious agent of the patient. Next we come to the mechanism of action. The main mechanism of action of the antibiotic is it will inhibit the cell wall synthesis of the bacteria. Okay, here you can see a sample of bacterial cell. So this is the cell wall, outer covering is cell wall, and this is the DNA, these are the ribosome, this is the cytoplasm. Okay, leave it. Main part is cell wall. Okay, so during antibiotic, when we are giving the antibiotic to a certain person, the antibiotic mainly break this cell wall. Okay, mainly break this cell wall. So when it break the cell wall, the inner part will go out. Okay, and this cell become damage or death. Understand, no? Because of the damage of the cell wall of the bacteria, so all the parts, all the organs, all the cells of the bacterial cell will go out from the cell, so that the cell become dead. Because cell wall is the one part that will help to make cover of these components of cell wall. Understood now? Action. Next are the, you can say, side effect, or next you can say indication. So indication, when we give the antibiotics in case of any infection like respiratory infection, urinary tract infection, we can give the skin infection, air infection, eye infection, throat infection, means whatever the infections you can find, we can give the antibiotics. Next you can side effect, nausea, vomiting, then fever, rash, chills, then hypersensitivity reaction. It is the main side effect or adverse effect of the antibiotics. And last one is nurse's role. The main nurse's role is divided into 2 parts. First is nurse's role in medication, and second one is nurse's role in patient. Whenever you write any nurse's role of any group of drug, just classify into 2 groups. First one is nurse's role in medication, and nurse's role in the patient. Okay, So in the nurse's role in medication, what are the nurse's role? As a nurse, you have to identify the drug doses, dose frequency. You have to know the action of the drug as a nurse. And in case of nurse's role in the patient, whenever you are giving the antibiotic, you have to check the drug dose frequency as well as hypersensitivity reaction of the patient. And if you collect the proper history of the patient, because some antibiotics may not resistance to the patient, so you can ask easily from the patient only. Okay, so this is the main nurse's role of the antibiotics. So this is all about the antibiotics in a short. Okay, so hope you will like this video. If you like this video, please do like, do share, and subscribe my channel. If you are new in my channel, subscribe and click the bell icon. Thank you.